I'm Louise Calong, and I'm a business owner, and I'm here at CSA. And I learned about CSA through a mutual friend of mine, and because I'm looking for a clinic that can take care of me here in Angeles City. So for today, I really want to focus on my nose, because growing up, it's always been my insecurity. I've always wanted a cute nose that's firm and small, so I hope to get that. So don't forget to click the notification bell and to make sure to subscribe, like and subscribe.
Good day, everyone. Welcome to the CSA Medical Aesthetics. I'm Dr. Contessa, your certified aesthetic physician. In today's episode, we have a new guest. Let's welcome Louise.
Hi.
She's still young.
Yes.
I thought she was like graduating from high school. Okay, Louise is in your what age?
I'm 26.
Okay,
Yeah.
So you're kidding me. 16? Okay. I was doing an assessment on Louise a while ago, okay? So checking on the overall, okay? At first, I noticed her skin is red. So I asked her what is her skincare regimen, and she shared with us like a light toner plus some glycolic with a very small percentage there, okay? Sometimes the glycolic acid can also cause some erythema or redness, okay? And other factors can lead to that, but that is not our topic.
Oh.
The important topic today is like a non-surgical way to improve our nose, to enhance our nose, and overall improve the face look, okay? Because the nose being at the center, it gives that very good attraction to other people. They're looking at our nose and they would say, oh, the nose is cute. I could say your nose is cute.
Oh, thank you.
It's our Asian trait. The nose is like this.
Yes.
And I love my nose. I love my parents. I love my ancestors. Okay?
Yes.
The thing is, right now, there are so many young people, like, going into a procedure that they want to really improve it. Some would want to do like, follow the nose of this actor, like a famous Hollywood celebrity. It's like going into having that Caucasian type of nose, okay? Because nose have different types or classification. So we are on the Asian type of nose, okay?
Yeah.
Now, we just wanted to somehow improve it, right?
Yeah.
And kind of like, follow certain right measurements there, okay? Like angles, rotations, I'm just curious, Louise, why choose non-surgical and not the surgical one?
Well, honestly, I'm happy with my nose, but I just want to tweak it a little bit.
Yeah.
Kind of like a quick fix.
Right.
Because I feel like going under the knife, that's a permanent decision.
Correct.
So
yeah.
I don't think I can, I don't want naman the perfect, too much height or like a totally different nose.
Yeah.
I like what God gave me, but I just want to a little bit manipulate it.
Right.
But
there you go. Tweakments. Right now we've been hearing about tweakments. Like a little enhancement there, little improvement there. Okay. Still natural looking. That's the thing right now. And you want to retain your identity. Just like me, okay? If I hate my parents, I will change my nose. But I love them, okay?
That's true.
So, there you go. So, what we're doing with non-surgical is like, just follow, again, like angles there, like in the height of the radix, or even in the tip, the projection of the nasal tip, and somehow narrow the sides of the nose, that they will still recognize you're still Louise,
yes,
right? So we're so excited today. We'll show the procedure when CSA Medical Aesthetics return. And we're back. So we're still with Luis here. Are you ready, Luis?
Yes.
Okay. Now, let's just give a brief history. Luis already had a non-surgical nose enhancement like 8 months ago, okay? So they used like those PDO type of nose threads on her bridge of the nose. So it was only the nose bridge that was like, worked on. So none on the tip columella region, okay? So for the procedure, we wanted to, of course, numb the area. We will be injecting a lidocaine at the tip of the nose at the entry point. Here you go. Just a tiny amount of your lidocaine. Now, some doctors are asking me, are you using like a lidocaine with epinephrine? Okay, so if I do a procedure combined with the filler, I use preferably lidocaine pure. Okay, but if there's no filler, I'll be using the lidocaine with epinephrine. So I need a hyaluronic with lidocaine here with cannula as well, gauge 22, and then use this entry point and just glide my cannula into the space. So preferably, we want the material to be on top of the cartilage and bone. So just glide it there and gently push a little bit already. So we want to reach the radix. Since you had a procedure in the past, Luis, I'm expecting some adhesions or resistance, okay? So it's normal to have this kind of tissue resistance whenever you have done a previous procedure already. So what I do is I still wiggle the cannula inside to make sure I'm in the right anatomical layer. So I'll push gently my product material here, gently, just a slow push. Okay. So I want her nose tip to be less round. Ideally, if the nose is already round, don't put any more hyaluronic substance there. So we'll use the threads now for the bridge. Do you remember how many threads they use for the bridge?
15, Doc.
Wow, that's a lot. So 15 pieces of your PDO nose threads. We're gonna pull out. Now, the length of the nose should also be taken into consideration, okay? Some individuals have longer, some individuals have shorter. So the type of thread that you will use should also be within that kind of right length. So follow the length of the nose of your patient. Like this one is a gauge 19 with 50 millimeter length of my cannula here, okay? There are cases that I use 40 millimeter length. There are cases I use 60 millimeter length. So depending on the nose length, okay? So this is just inserting the PDO threads in the tissue space, preferably above the bone and cartilage, okay? How are you, Luis?
I'm good.
So once we're done with the bridge, we will also improve the nasal tip. Okay. So typically Asian nose, we have a round shape tip of the nose, right? Luis?
Yep.
Bibilugin ang ating nose, okay? So we want the nose to be less round. The others want the Caucasian type of nose, very pointy. And we'll make a second entry point. There are cases that I use the same entry point depending on the columella length, okay? So can I have an OS again, please? Because this is slippery. So I need to pinch. So ideally, you pinch the nose tip like this and insert in that entry point and glide your cannula into the columella space and go as deep as your anterior nasal spine. Okay, so you have to make sure your tip of cannula is in the anterior nasal spine. So we'll inject a bolus of our hyaluronic material there. And then after that, you can use our shorter PDO thread. So make sure the entire length of your thread will be inserted in that columella space or the so-called intercrural space. So no thread extruding from the entry point. Okay, so we'll actually add another treatment for her, which is the Botox, just to narrow the sides of the nose. And I noticed that the nose of Luis is oily.
Yeah.
So we have this sebaceous glands on the nose, okay? And because of the sebaceous glands, these are also like tissue structures that produce your sebum, your oil. So excess of the sebum or oil within the nose tip, okay, will also kind of like, they also occupy a certain space in your tip nose. So we can do also a so-called meso fat dissolve for the nose tip, because Asian nose, actually we have thicker tissues in our nose, especially in the tip area. We have the superficial fat, the deep fat. So we wanted to reduce those fatty tissues as well. And we need to also reduce the size of the alars, the so-called intercanthal width. So when you want to assess that, you can measure by making like a straight line from the medial canthus. Okay, so the intercanthal width, we have to follow the so-called intercanthal width. Okay, so now let's inject a bit of our alar tox, just a little bit. Okay, love you, Louise. Okay, just a tiny prick here and a push of your medicine there. And same thing on the other side, just a tiny prick and infusion of your medicine there. So kind of stinging sensation. It's okay, you're still good, right?
I'm still good, Doc.
Okay. As ang tolerance ni Luis, just like me. Yeah. I'm also self-injecting, would you believe? I inject my alars with the same product. Okay. Yeah. And then we can also inject some of our mesotherapy. So we also do nose slimming with our fat dissolved solutions. So we inject subcutaneously here at the tip of the nose, just a little bit. Just a minimal amount to reduce the fats in the area. There you go. So it's a combination treatment. We did filler, threads, alar tox, nose slimming. We will show the result to Luis when CSA Medical Aesthetics returns. And we are back, so let us show the result to Mom Louise. Here's our mirror, Louise. You can now check the
Oh my
result.
gosh, I don't have to use a filter. Oh my God. Fine.
So we did a combination procedure for her. So we use our hyaluronic filler. We also use those PDO threads, plus the nose fat dissolve and the alar tox. Okay. So on the profile view or side view, if you look at the radix there, the frontonasal angle, somehow we have improved it. And then the nasolabial angle, we want the 95 to 105 degrees. And we were also doing the measurement of the intercanthal width. So somehow we were able to make it enter the intercanthal width. And looking at Luis right now, wow. Yeah. Kind of also her eyes became, kind of there's something different. You're blooming, okay? We're just improving that radix projection, nose tip projection, and overall, I could say, beautiful. Yeah.
Thank you, Doc.
Plus, you know, whenever we do nose projection, it has an effect of like the face will become narrower. So when you project it anteriorly, okay, pa-forward, Luis, so parang ang face mo rin nagnanarrow. And plus, yung eye area, it kind of help also rejuvenate the eyes. Okay? Actually, nose thread lifting, we also use it for our patients na mga ages 50s, 60s, and above for anti-aging, for rejuvenation, especially around the eye area, because the nose will also age. We also get wrinkles here, the so-called bunny lines, and the tip of the nose will droop down as we age because of like bone resorption under, like maxilla bone resorption, soft tissue resorption, or atrophy. Comments, Ma'am Louise?
I'm just so happy. it's the filter that I wanted, and now it's in my face. So
It's there already.
yeah, I'm so happy.
okay.
Thank you so much, Doc.
You're welcome. Actually, we will still do a follow-up on Louise to check on the effect of the Allertox and the Mesonose, because this ones we wait for the outcome of this Allertox and the Mesonose. Now, with the combination filler and threads, you will see instant result. But they will still work inside, okay? Those PDO threads will do neocollagenesis, neoelastogenesis, neoangiogenesis. So it's not just this time that you see the result. So like 4 weeks, 8 weeks, 12 weeks, they will still work inside. You will still see an improvement. Plus, your hyaluronic substance is also for volume restoration, or it will help in the augmentation as well. Plus, hyaluronic is present in our tissues. So the procedures that we're doing here are really clinically proven safe. So there are scientific studies about these kinds of treatments. The materials that we are using, they are FDA approved. So we're guaranteed of the safety, okay? That's why we want to remind everybody, okay, just go to your trusted aesthetic physicians, those qualified, authorized, legally authorized to perform these kinds of procedures, okay? So, and beware also of, non-MDs doing this, because we have a lot of, or there's an increasing number of complications right now from nose injections. Take note, the nose center of the face is like a danger area also. We have a lot of blood vessels there and other structures that are connected internally. Okay, so be careful also. Now, in our center, we've been doing nose procedures, non-surgical nose treatment for like more than 10 years, actually. So, in terms of experience, in terms of the knowledge, the skills, we have it here. Okay? Thank you!
Thank you so much. Go ahead, go to CSA, guys.
So, any social media that they could follow you?
Oh, follow me at The Boss Louise on Instagram and on TikTok. Thank you.
Wow. Thank you so much, Louise, for trusting us.
Doc.
Okay, if you have any questions, you may email us at csaskinclinic@yahoo.com, our FB page, CSA Medical Aesthetics, Instagram, CSA Medical Aesthetics. Our clinic is located here at the Infinity Shop, Pulong Maragul, Angeles City. Contact numbers 0933-860-9193 or 0917-504-4268. And please do watch our other video episodes at our YouTube channel, Contessa Salvador. Thank you so much. God bless you all. When it comes to natural beauty, you can trust the CSA Medical Aesthetics.